Our next speaker is Dr. Benjamin Eidelman from the Department of Neurology at Mayo Clinic in Florida. He's professor of neurology, director of the Vascular Neurology Fellowship, and he's going to talk to us today about systemic and uncommon causes of stroke. So please welcome Dr. Eidelman.
Well, ladies and gentlemen, Dr. Barrett, I'd like to thank the organizers for providing me opportunity to discuss this important topic. Now, the topic I'm going to discuss, I have no disclosures. The topic I'm going to discuss are going to be unusual causes of stroke. And this slide provides a practical, but by no means comprehensive classification of the conditions that may occur outside of the more commonly encountered disorders that we see in everyday practice. There are many, many conditions that can cause stroke, and as I say, they're beyond those typical conditions that we see on an everyday basis. And this classification forms the basis of my talk. I'll be looking at vessel wall disorders that give rise to stroke, infections and stroke, some illicit drugs and stroke, and hematological disorders that give rise to stroke. Now, in the interest of time, I'll only be covering certain topics, which I regard as the more important, and also some have already been covered by other talkers. Now, looking at the vessel wall disorders, these may be classified into non-inflammatory blood vessel conditions and the inflammatory blood vessel conditions. Of the non-inflammatory blood vessel conditions, here are some important entities that one needs to be aware of: fibromuscular dysplasia, radiation-induced vasculopathy, moyamoya disease, Fabry disease, arterial dissection, and malignant infiltration of blood vessels. Inflammatory blood vessel disease may include isolated angiitis of the CNS, already discussed, temporal arteritis, infection-related vasculitis, and toxin-induced vascular pathology. Now, of the non-inflammatory blood vessel conditions, fibromuscular dysplasia is an important disorder. Fibromuscular dysplasia can be classified as a idiopathic, non-inflammatory, non-atherosclerotic angiopathy of the small and medium-sized arteries. The blood vessel wall is replaced by fibrous tissue. Prevalence really not known. It's more common in young women. Ratio of women to men 3 to